Hello, I'm Dr. Arshnoor from DR.ARSHNOOR'S OET Institute. I've started a series of the role plays for doctors and the nurses, and today's topic is for nurses. The patient setting is hospital, outpatient clinic, and second, nurse is attending the patient in the outpatient clinic. OPD means OPD. Now, the patient is being discharged after having the surgery. That is a day surgery, and there was no admission for day and night. It was only for a few hours. He underwent the surgery and is being discharged. The nurse role is to give him recommendations after his discharge to take care of the wound at home. The aspirants, it's an important task as wound care is very important, and we have to go with the proper topic as it in the beginning it is given confirmed reason for seeing patient, carpal tunnel surgery, information about wound care, find out how the patient is feeling. As I started with this topic, and after the nurse introduces herself by saying that my name is so and so, and I am the nurse in charge in this hospital outpatient clinic, or I'm one of the registered nurses working in the hospital outpatient clinic. So let it be the patient Harry. Harry, how are you feeling today? So this is 48 years old, and I've already told you above 55 or above 50, you should use Mr. or Mrs. for the patient. Below that, you may directly call the patient by the name. Let's the name of the patient Harry, and the nurse is asking Harry, how are you feeling now? Because underwent surgery, and now she's expecting him to be a bit in pain, or it might be that he's feeling okay. So because we are not expecting the good results or the relief from the problem he had. He underwent carpal tunnel surgery, which means that it is the surgery, it is incision on the palm to release the stretching he was feeling earlier. So the nurse, one thing very important for you, do not use much of the medical terminology, because the person sitting in front of you is expected to be a layman. So it's better to use a layman's language, the simple language, so that it should be properly understandable by the patient or the interlocutor. Now, let's start with the topic. So first of all, confirm the reason for seeing the patient, that I have already told that, uh, Harry, how are you feeling now? So the patient may say that I'm feeling a bit pain. Then you have to tell the patient, Harry, it's quite common after the surgery, as you underwent the surgery, and once the effect of anesthesia is over, so this pain is expected. I'm giving you an injection of analgesia so that it should relieve your pain. Or you may say anything here. Give information about the room wound care. Now, as the patient is being discharged, so you have to tell that, Harry, we have already given you analgesia with the effect of this will stay for 5 to 6 hours. And after that, you should start with the oral medication. You need to take the medicine prescribed by the doctor regularly, so that there should not be any complication with the wound. Now, in this task, it is given information about wound care, removal of outer dressing in 24 hours, leaving wrist dressing in place, keeping dressing clean and dry, advice on likely time scale for healing, example, 2 weeks, or removal of stitches in 10 to 12, 14 weeks. This will be the mainly conversation between nurse and the patient, and the patient would ask the nurse that, how much time would it take for me to get fully recovered from this? The nurse may say that it may take 2 to 3 weeks, as sort of a wound heals in that much time. And secondly, the nurse has to strictly warn him regarding some important instructions, like he should not wet his hand, avoid any water games or water activities like swimming, because it is not that you will wear the plastic gloves or something and you will expect it to be clean and dry. No, So once it is wet, so there are chances of infection in the wound, which need to be avoided. And for that reason, you have to keep your wound clean and dry. Dry means stay away from water as much as you can. Do not let your dressing get wet. And second thing is that this dressing will be changed after 24 hours, and be regular with the dressing because this is a crucial part in the wound healing. Then one against swimming, I've already told you, plastic infective for that, complete dryness, risk of infection, longer healing time, explore patients' understanding about the care of the hand. You have to ask that, Harry, can you please tell me that how would you take care of your wound at home? Would there be anyone else who will assist you or take care of the wound in doing dressing and taking care of the wound, or it will be you yourself? So you may give him an option that you can come to the clinic to get your dressing done every day. Then remind patient about the care of the hand, elevation to minimize swelling, light use 48 hours post-operation. Fine. This is important. I'll first explain this. The patient needs to elevate his hand so that there should not be any swelling or to avoid pain, because when the hand is on the lower side, in that case, the hand will get swollen and there would be pain on that. To avoid that, hand should be elevated so that he should not find any pain, then there should not be swelling. Secondly, he should be regular with the medicine. Thirdly, there should be finger movements. Finger movements means the mobility of the fingers. This is an exercise which will be told by the nurse for the proper healing of the wound. Pain relief as required, as I've already told that you should have to be regular with the medicine. Then remind the patient about the particulars. Example, no heavy lifting, driving until wound healed. Find out any fine. So then the next recommendation by the nurse is, Harry, there is an important instruction for you that you have to avoid driving because this is your palm. And if you start doing driving, in that case, it will take much time for the wound to be healed. For that reason, it is crucial for you to avoid driving for at least 3 to 4 weeks till the time your wound gets properly healed. Secondly, do lift any heavy object. Rather, I would suggest you that avoid lifting any object by this hand so that the by the movement of the hand, your wound should not be complicated. Then emphasize provision of discharge pack. Example, follow-up appointment information, wound care, medication advice, hand exercises, advice when medication attention needed. For example, fever, yes. So you may say, Harry, there are some important instructions for you. See, students, as I'm in a habit of using, no, it's not me, but many people, they use important many times. You can use other words. It is essential, crucial, pivotal, vital, imperative, mandatory. To avoid the repetition of important here, you may use essential. It is essential that you have to take care of your wound properly and come for a regular follow-up at the clinic so that the wound should be assessed and avoid any type of the complication in the future. Secondly, Harry, you find any type of the problem like fever, excess pain, intense pain, you can use the word intense pain. In that case, you can contact us an emergency number. Do not avoid this situation because it may lead to some serious consequences afterwards. So it needs to be properly handled immediately. In this case, you can contact us or you can come to the clinic for the further details or further treatment. This was all. I guess I've completed this topic. Yes, no heavy lifting until, yes, the whole topic is done. Nurses, it's important for you. You may essential for you that Do not miss any important information. As I'm explaining this verbally, I haven't made any notes here. So it is an instruction for you that first of all, you should read the task 2 to 3 times. Then important information that should be written on the page, which will be given to you by the examiner at the time or interactor by the time of the exam. Then you should prioritize the information. Which information is to be given first and which information is to be given afterwards. For example, in this case, first of all, how to dress the patient. As the patient is in the clinic and you're going to discharge the patient, you have to give the information that, Harry, you are being discharged now, but there are some important informations to be given or instructions to be given. I'm going to give it to you right now. Then you can tell about the dressings to be done, taking care of the wound, and important instructions to be followed afterwards. So in this way, you can finish him at the end, Harry. Do come for the follow-up after 3 days, because the doctor will assess your wound, and the further treatment will be given to you afterward if it is required. Otherwise, you'll be given the regular treatment which is given to you right now. In this way, you can end up the task. There is nothing left here now. I've completed the whole task. Hope you like this video, as I'm choosing different type of the role plays every day, so that it should be beneficial for you in the exam to go through different role plays and be able to practice on this. If you like my videos, do not forget to like and share it with your friends and the colleagues and the people who are planning to appear in that test. Otherwise, it could be for your practice, uh, for the test, or even the normal improvement of the English also. Secondly, if you have not subscribed our channel yet, subscribe it right now, so that you should be able to get the latest information whensoever we are uploading any new video on our channel. Thanks for watching. Stay connected. Happy learning. See you very soon with a new video. Till then, bye-bye.